Welcome back to In Focus. Joining us now is In Focus health reporter Linord Moudou, and today's topic, fighting back at one of the continent's biggest killers. Linord.
Hello, Vincent. Well, new statistics show that there are some improvements in the global efforts to control malaria. The World Health Organization says every 45 seconds a child dies of malaria as opposed to every 30 seconds in the recent past. Professor Awamari Kolsek is the executive director of the Rollback Malaria Partnership. She says better funding has helped in the fight against malaria.
10 years ago, we had something like $60 million for all the fights against malaria. With this money, which has increased to reach in 2010 $2 billion, we have seen now a difference in coverage. We have also for all the treatment, the spraying in-house, everything is going up.
Professor Kolsek says leaders in Africa have also become more involved in combating malaria in their countries.
Countries are now together speaking of malaria every 6 months in our board. They are represented on our board. And the constituencies the most represented is the endemic countries. What we have today is an alliance of head of states from Africa. And this will change, for me, the political will. Because at the level of head of states, now it shows that all countries will have all the means possible and the commitment necessary to have a lot of success.
African leaders have coordinated their efforts globally as well as locally. With the establishment of the African Leaders Malaria Alliance, governments in Africa have come together to send a clear message that malaria deaths are unacceptable. President Jakaya Kikwete of Tanzania.
Malaria is a disease that affects between 300 and 5 million people the world over every year. But 90% of those who suffer from malaria happen to be in Africa. And 85% of the 1 million deaths again happen on the African continent.
The executive director of Rollback Malaria says that the fight against malaria could not have improved without the involvement of local communities.
This idea of having the community taking their own destiny is very important. And it has been key with the result we have today. And it is why we don't need to use them. They need again to own the fight. But without them, nothing will change.
Marie Kolsek says that with combined efforts, many countries in Africa have become malaria-fighting success stories, including Rwanda, Botswana, and Zambia. But challenges still remain to decrease the burden of the disease in Africa and the world.
We need to intensify our effort. 2 countries we are focusing now, Nigeria and DRC. Because for us, they are the biggest country in Africa. If we are not able to change things in these countries, the global figures will not change. But we think that maybe in 2 years, the 2 big countries will have done a lot of achievement, and this will shown at the more global level.
And that's all for today.
Thanks a lot. Thanks a lot, Linord Moudou, for that very informative health report. And that's our show for today. Thanks a lot for watching. Have a good night.